I want to sneak in a special thank you to Steve Ewell and the CTA Foundation for co-hosting this sixth philanthropic collaborative. CTA has been with us from the very, very beginning, and we really appreciate it.
Well, thank you for having us, Katherine. Always a pleasure to be a part of it. So thank you.
Right. So as we wait for others to join, we'll get this started. Hello and welcome, everyone. Thank you for joining us for the 2026 ITNAmerica Philanthropic Collaborative co-hosted by ITNAmerica and the Consumer Technology Association Foundation. My name is Marcia Black, and I'll be one of your hosts today, and we're thrilled that you're all here. To get us started, I'd like to introduce Bob Blancato from the ITNAmerica Council of Advisors, who will offer some opening remarks. Bob?
Marcia, thank you very much. And I am very proud to be a member of ITN's America's Council of Advisors. I welcome everyone today to the Philanthropic Collaborative, a national grassroots approach for a national need. And safe mobility for our aging population affects every family, business, and community in America. I'm coming to you from the annual meeting of the American Society on Aging, and I can tell you this topic has come up over and over in different sessions. So thank you, everyone, for coming. This is our best attended event. It is just over 1 hour, but it will go very quickly. Each speaker today connects to safe mobility for older adults from a different perspective. Our leader, Katherine Freund, ITNAmerica's founder and CEO, will begin by sharing a few words about ITNAmerica's work and the launch of America's Volunteer Driver Center, the National Center of the Public Information Campaign for Volunteer Driver Recruitment, a grassroots national effort to recruit 150,000 volunteer drivers by changing the way Americans think about and support nonprofit transportation for older adults. Nancy LeaMond, Chief Advocacy and Engagement Officer at ARP, and a longtime friend, will share a national perspective on aging, advocacy, and engagement on behalf of Americans 50 plus and their families. Andy Lowe, Executive Director of the New England Rural Health Association, will bring a rural health perspective from across 6 New England states. And finally, and perhaps as important as anything, we will hear news from the transit frontier with speakers from the field, the people who are out there doing it, a nonprofit transportation leader, a volunteer driver, and a rider, who will share what this looks like on the ground from the grassroots level. At the end of the event, we will have 10 minutes for questions and answers, so please be prepared. And I will turn the program back to Marcia.
Thank you, Bob. Now it's my pleasure to introduce Steve Ewell from the Consumer Technology Association Foundation. Steve?
Thanks, Marcia. And yes, it's a real pleasure to be here and be part of another one of these philanthropic collaboratives. We've been co-hosting this with ITNAmerica for a number of years now, and I love seeing how this has continued to grow. As Bob shared, this is such a critical issue area, and we're thrilled at the Consumer Technology Association Foundation to have been supporting ITNAmerica since about 2020, and actually just yesterday had a board meeting where we just approved another $50,000 grant to ITNAmerica. So we're thrilled to continue to support this critical work and build the network of organizations and supporters that are doing this work across the country. So thank you all for being here, and I'm looking forward to a great event today.
Thank you, Steve. Now I'm glad to introduce Katherine Freund, the founder and president of ITNAmerica.
Hi, everybody. There's our Volunteer Driver Center logo. I hope you like it. I designed it on ChatGPT. This is the 6th philanthropic collaborative, and the collaborative works on various issues that support nonprofit, community-based volunteer transportation. And we dedicate the collaborative each year to a different aspect of it. This year, the effort is dedicated to America's Volunteer Driver Center, which is a national grassroots approach to a national need. Next slide, please. So the goal is a national public information campaign to change the way Americans think about and support nonprofit transportation for older adults. And it's hard to say which piece of that goal is more important, changing the way people think or changing the way people support. I guess they're both equally important, but super, super important. Want to take a minute to thank our senators from Maine, Susan Collins and Angus King, who helped us by providing the funds to do this planning effort for America's Volunteer Driver Center, which has been a 3-year effort of pulling together a very large national coalition to work on a national need. Next slide, please. Thank you. So what do we mean about thinking about transportation for our aging population? I think of all the unmet needs in society for older adults, transportation, as Bob Blancato said, comes up all the time, but somehow or other, we think of it in each individual community separately. And there are so many commonalities that we can work together on. First of all, older adults outlive their decision to stop driving by about a decade. And when they do, they need a transportation alternative. Because the population is aging, about 20% of the population is going to be 65 by 2030, there is a growing gap in the number of people who limit or stop driving and the need for alternatives. It grows literally daily. Also, 3 out of 4 older people do not live in the higher density areas where there is traditional mass transportation available for them to take. And also available in the higher density areas are the for-profit rideshare services. Both of these transportation options, public transportation and for-profit rideshare services, they meet some of the need. But most of the older people don't live in the places where those services are available. So they fall short, not because they're inferior in any way, but because they just don't work in the lower density areas. Next slide, please. So America's Volunteer Driver Center, as Bob said in the beginning, is an effort to recruit 150,000 volunteer drivers. We did not pull that number out of the sky. We did a lot of work in our planning effort to look at successful nonprofit public information campaigns and nonprofit volunteer recruitment campaigns. And we learned that Meals on Wheels actually recruited 150,000 volunteer drivers. And we think that if they can recruit volunteer drivers to bring people lunch, we can recruit volunteer drivers to get people to healthcare, to the grocery store, to volunteer activities, to work activities, really to do all the things that make life worthwhile at any age, regardless of age. A nonprofit community-based volunteer service is lower cost to produce than any other transit. It uses existing private vehicles. It can scale nationally. ITNAmerica has been working on this now for 31 years now. And we've put together a very broad and diverse coalition of organizations from government, from the nonprofit sector, and especially from the business sector. Next slide, please. This is how it's going to work. With a grant from the Next 50 Foundation, we built a beautiful website that has 2 portals. one for volunteers, and one for providers. Anybody in the country who wants to help out by volunteering to drive can sign on to that website, and we're going to put that in the chat for you so you know where that website is. And any nonprofit or public transportation provider in the United States can sign on to the provider portal. And then we will introduce them to each other. We are not going to try to match volunteers with local organizations. We absolutely know that local organizations know their local community infinitely better than we would ever know their local community. So we're going to do the things that we can do, which is a public information campaign, a terrific website. Oh, and by the way, CTA Foundation funded text messaging for us so that people can communicate with us with their smartphones, which is very important these days. So that's what we're going to do, the campaign. We're going to raise the awareness of people throughout the country that this is a very big unmet need. And, you know, we like to say that the answer to this problem is parked in driveways from coast to coast. Private vehicles are not used 95% of the time. And we believe that if we ask people to give an older person a ride, that they will do it. They just are not thinking about it. They're not aware of it. So we think this is a very, very solvable problem. Next slide, please. So that's what I meant by getting people to think about it. That's what our public information campaign is going to try to do. But we also want people to support the solution. It's one thing to understand the problem. It's another thing to do something about it. We're going to ask people, we're asking you to sign up as a nonprofit transportation provider. For all those providers who are listening in, please sign up. And for all those people listening in who would be willing to give someone a ride, please sign up to volunteer to drive. I was in Washington a couple of months ago for a meeting, and I found out that you cannot buy a cup of coffee for less than $5. So I thought, well, for $5, why not join the national grassroots campaign at the local level? So if you go to our website, and that's also going to be put in the chat, and want to join the grassroots effort for the cost of a cup of coffee, we would love to have you with us, and we will send you, see those grass seeds? We made those packets. That's a grassroots effort. We will send you grass seeds, and the first person who did join actually said he was planting his grass seeds. He was thrilled, and he was asking 2 of his friends to sign on so that they could plant their grass seeds as well. So very local, very personal. I really believe in the democracy of grassroots efforts, and it's not just for politics. It's for social needs that people can be a part of addressing. Next slide, please. Nick just asked me why I had the grass seeds twice. One is for the local grassroots effort. And when we say we want to do grassroots at the national and the local level, we mean it. These are some of the national and state organizations and foundations that are working with us to do grassroots at the national level. And that means we're working with any national organization or state organization that wants to join our effort and get the word out through their communication channels. All organizations have some communication channels, and if we spread the word that way, and if we spread the word locally and through social media and so forth, we know we can help millions and millions of people and do a tremendous amount of good. And I think I have one more slide. Yeah, there's my contact information. And I've been asked to be really careful to do this in 10 minutes, and I think I just made it. So thank you all very much.
Thank you, Katherine. Now we'll hear from our 2 keynote speakers. First, I'm pleased to introduce Nancy LeaMond, the Chief Advocacy and Engagement Officer at AARP. And following Nancy, we'll hear from Andy Lowe, the Executive Director of the New England Rural Health Association. But before we begin with Nancy, a quick housekeeping note. After both speakers have concluded, we will open a brief question and answer period. You can submit questions anytime using the Q&A button at the bottom of your screen, and we will take them following Andy's remark. Now I'll hand it over to you, Nancy.
Well, thank you very much. Good afternoon, everyone. It's wonderful to be with you. Thank you to the Philanthropic Collaborative for bringing us together today, and to the Consumer Technology Association Foundation for co-hosting this important convening. And I also want to thank Katherine Freund for the invitation, and ITNAmerica for organizing and sustaining this annual event. I am especially grateful to be with you during National Volunteer Month. Some of you may have heard of AARP. Some of you may have even gotten a letter from us in the mail at one point or another. AARP is a mission-driven organization, and none of what we do would be possible without the dedication of an army of 60,000 volunteers. They are truly the lifeblood of our organization. You can see them in red shirts on Capitol Hill and in the state houses across the country. You see them staffing community events, delivering presentations, and serving as trusted barometers of what's happening in their communities. And just as importantly, thousands of older adults would be left without vital transportation options were it not for the work of the organizations here today and the many selfless volunteers all of you lead. I want to start with something simple and true. Transportation is not just a ride. Transportation is access, it's independence, it's dignity, and it's connection. And at some point, it touches every family in America. Most of us can picture that moment. A parent stops driving after an illness. A neighbor no longer feels confident behind the wheel at night. A spouse is juggling work, caregiving, and everything in between, trying to figure out how to get somebody to an appointment, the pharmacy, or the grocery store. And when transportation becomes uncertain, everything else becomes harder. Health gets harder, work gets harder, staying connected gets harder, remaining in your home and your community gets harder. This is personal to me. Like many of you, once a month, I block time on my work calendar to drive friends to doctor's appointments. It's a very small act, but it offers a glimpse into the reality of millions of families are facing every day, often quietly and often without enough support. As this group knows, the scale of this challenge is significant and growing. More than 52 million Americans aged 65 and older are licensed drivers today. That means more people than ever will eventually face the difficult transition of limiting or stopping driving, often in places where alternatives are limited or virtually non-existent. Nearly 80% of older adults live in car-dependent suburban or rural communities. And in those places, losing the ability to drive does not just limit independence, it can cut someone off entirely. And while new mobility options have expanded choices in some areas, for many older adults, these options simply are not available when and where they're needed. And that makes volunteer transportation not a nice to have, but a critical necessity. And when transportation becomes harder to navigate, the effects do not stop at the curb. They ripple through health, finances, and family life in very real ways. When people cannot get to appointments, care is delayed or missed altogether, often leading to worse health conditions. Transportation costs also strain household budgets, principally for people with disabilities, lower income individuals, and those on public insurance, forcing difficult trade-offs that families absorb quietly and often without support. Those pressures fall especially hard on family caregivers. Transportation is one of the most common supports caregivers provide, whether that means giving rides themselves or coordinating them for loved ones. And when accessible options are limited, caregivers take on more and more responsibility, stress increases, and burnout becomes likely. At the same time, older adults face isolation, which we know is closely linked to poorer physical and mental health. In the face of all of these challenges, I'm proud of AARP's work in this space and grateful to be here today with leaders who understand that transportation is foundational to health, independence, and community connection. At AARP, our focus is on advocacy and programs that remove barriers and strengthen options. We work at the local, state, and federal levels to support safe and accessible transit, paratransit, pedestrian safety, and broader mobility policy. And we're increasingly focused on practical policy changes that make it easier for volunteers and community-based providers to step in when traditional systems fall short. This includes support for volunteer driver programs. In Connecticut, for example, AARP supported legislation to ensure people are not penalized by their auto insurers simply because they volunteer as drivers for nonprofit organizations. And we've also supported efforts in states like Rhode Island and Mississippi to reduce barriers for transportation providers and preserve access to essential mobility services. Alongside our advocacy, we help communities become more age-friendly by partnering with local leaders to identify transportation gaps and implement practical, on-the-ground solutions that reflect the realities older residents face. Our nationwide Community Challenge Grants program has supported this work, helping communities turn shared challenges into meaningful progress rooted in how people actually live. And because families are often carrying the weight of these decisions on their own, we also equip older adults and caregivers with tools, research, and resources to help them plan for mobility changes before they become a crisis, not after options have already narrowed. Last, but certainly not least, we have a wide range of transportation education options through our driver safety program, designed to help drivers and riders remain safe, independent, connected, and confident as they age. This includes everything from a free online workshop on rideshare and delivery services apps to support transportation access and education, to courses designed to refresh driving skills, keep people safe, and help them save money. And I have to say, almost every year, our so-called best-selling publication is How to Have a Conversation with Your Parents About Giving Up Their Car Keys. All of this brings us to a clear conclusion. Transportation for older adults is not a side issue, a future issue, or somebody else's issue. It's a shared challenge that touches health, caregiving, affordability, and community connection. And it is exactly the kind of challenge that volunteer transportation, supported by smart policy, practical innovation, and strong collaboration, is uniquely positioned to help solve. My belief is simple: people need a ride. And when we work together across philanthropy, technology, nonprofits, volunteers, and communities, we can make sure, quite simply, that they get one. Thank you so much for your time today, and more importantly, for everything you are doing to help keep older adults connected to the people and the places that matter most to them.
Thank you, Nancy, very much.
Good afternoon, everyone, or good morning, depending on where you're located. Again, I'm Andy Lowe, Executive Director at the New England Rural Health Association. And I first met Katherine at a conference last November, immediately after our Rural Health Conference. And as soon as I heard about the work that ITNAmerica was doing, it became clear to me that this was an organization that we intended to partner with as a state rural health association. Just quickly, there are state rural health associations in all of the states that are chartered through the National Rural Health Association, with missions of improving the rural health in their respective states. And we're the Rural Health Association for all 6 of the New England states. And for those of you who aren't around the region that much, that's Connecticut, Rhode Island, Massachusetts, Vermont, New Hampshire, and Maine. And it was, as I said, it was immediately clear that this was something that was going to be a partnership that was really important for us in order to help achieve our mission. And we have very complementary missions with ITN. So we go to the next slide, please. What I want to talk to you today is about rural health and the intersections of transportation, particularly for older adults. So, and this is echoing some of the things that Nancy was saying earlier, but our rural populations are in general older, sicker, and poorer. They're aging faster than their non-rural counterparts too. That's one of the things that's really driving some of the things that are going on. And rural populations have, in general, poorer health outcomes and higher costs for care. And I think everyone's aware of how important it is to the entire system at large to keep our healthcare costs down, because as we know, insurance is spiraling out of control. Costs relating to just every aspect of health is, and so that's the rural populations are disproportionately affected there. And of course, people living in rural areas experience longer travel times and distance to all kinds of care, but particularly specialty care. That's one of the issues. If you don't have an easy way to jump in your car and drive to a hospital that's close by, to drive to a clinic close by, you're going to have a hard time, especially if you don't have access to your own transportation. So our rural populations face limited access to care, and some of the kinds of organizations that are offering that care are critical access hospitals. Those are typically hospitals with 25 or less beds in them. Rural health clinics, community health centers or federally qualified health centers. And then there's a host, another constellation of care providers, such as long-term care, nursing homes. We think about emergency services, things like that. And then a bunch of, a whole lot of care providers that deal in social services and so on. Next slide, please. So what is rural? A lot of people think, there was mention earlier about Connecticut and Rhode Island, and I think a lot of people around the country think there's not much rural in Connecticut and Rhode Island. Well, it's not true. Every state in the country has rural areas. There are a lot of federal definitions out there. The Health Resources and Services Administration has one. The U.S. Census has another. The USDA has another. There are many different ones, and they don't agree. And a lot of them are a little bit on the arbitrary side, and they actually date from older definitions of rurality. All of the states have what's called the State Office of Rural Health, and many of them have developed a state definition. And those are much more comprehensive. And I assure you that every state out there has one. But the things the rural communities have in common are isolation. We have to think of the time to get to care or services, not just the distance. Especially in our smaller New England states, you could be 15 miles from a metropolitan center in a rural community, and you might as well be on the moon if you don't have your own transportation. There are not as many local resources around. On the positive side, rural communities share that sense of community. Rural communities are closer than you think. Again, we'll think of something like Rhode Island, the smallest state in the country, pretty densely populated, most of it. But Block Island is just off the coast and it's extremely isolated and rural. So they're all over the place. We think of islands. There are hundreds of islands off the coast of Maine, for instance, and people are living on those. So think about some of those areas. Next slide, please. Some of the threats to rural health that are looming is the one big, beautiful budget bill, so-called OB3, is making cuts to Medicaid, including benefits, as well as loss of eligibility for some of the RIDE programs. Those cuts are going to kick in at the beginning of next year, 2027, and they're going to affect a lot of people. Shrinking workforce. Rural communities have, all healthcare providers are having trouble recruiting and retaining workforce. In rural communities, it's harder still. There just aren't as many people going there. They sometimes have people attracting them because of the same kind of lack of issues that cause rurality sometimes are going to be not as attractive to some people. And one of the things to think about is these kinds of issues are all threatening our hospitals and clinics. And if those closures happen, as they are happening, we're going to see less and less access to care. Some of you may have heard about the Rural Health Transformation Program. It's kicking $50 billion into the rural health system across the country. That's really good news, but it's important to note that that's somewhat less than a third of what the states are going to lose, what the rural areas are going to lose, just through the cuts to Medicaid alone. Next slide. So rural equals older, really, in many cases. Currently, 1 in 5 rural Americans are over 65. That number is growing quickly as they age more quickly. The younger population in rural areas is declining rapidly as people move away, with declining birth rates, those kinds of things. These numbers are general, but if you look county by county and community by community, actually they're much, much greater. Many of our rural communities have far higher median ages than communities at large. And as we said, there's limited workforce too. If we go to the next slide. So this is from our rural health data dashboard at the New England Rural Health Association. And the numbers may be a little hard to read. You can see the bar chart on the left that for rural populations, the median age across the region is 20.4% compared to 16.7% for non-rural communities. But if you look at some of the counties, and again, you may not be able to read it too well here, and there is a link when you get the slides, you'll be able to get to this. Many of them are well up in the almost 30% of 65 years or older. Next slide. Okay, another equation that is important to understand is that distance equals disparity. Rural populations have higher incidence rates of all of the following: all causes of death, suicide, Alzheimer's, chronic conditions like diabetes and hypertension, heart disease, etc., falls, motor vehicle traffic deaths and injuries, and so on. And all of those things get magnified the farther you are from sources of care. That's one of the reasons why those rates are higher, is people have lower access to care. Next slide. We're going to look at another chart from another map from our health data, rural health data dashboard. Here we're looking at the percent of the population that is more than 15 miles from any hospital. And the difference is rather staggering. And you'll see in my own state of Vermont, in the Northeast Kingdom, what we call the Northeast Kingdom of Vermont, 35% and more in some of those counties and so on. So as I mentioned, distance, again, does equal disparities in that if you don't have the ability to use private transportation, the lack of public transit capacity is going to be a real problem. Next slide. So social determinants of health is one of the areas that's gained a lot of notice in recent years. It's important to realize that 80 to 90% of the contributors to the overall health and wellness go on outside the 4 rooms of the clinic or the hospital. They're things like housing, food, social connectedness, is all what we call social determinants of health, or SDOH. But rural healthcare providers and advocates will tell you, if you ask them, that transportation is by far the largest social determinant of health, because it affects all of those other things if you can't get to care and services. So the availability or lack thereof of transportation determines your ability to access care. Next slide. So isolation, one of the things that happens if you don't have access to transportation, and particularly your own, is physical isolation. Of course, you're farther away from things, but that can lead to social isolation. And that is another key determinant of health. Social isolation has impacts on behavioral health in terms of increased rates of depression, anxiety, substance use disorders, suicide, things like that. It also has physical health impacts. People with experiencing social isolation will have higher rates of hypertension or high blood pressure, type 2 diabetes, heart disease, obesity, and all kinds of things like that. So isolation basically equals a reduction in overall health and well-being. Next slide. So why is transportation different in rural areas? Well, this picture is from my home state of Vermont, and I've lived on a road like this for a lot of years. I have the luxury to be not on a dirt road at this point, but this time of year we call mud season around here because the frost is going out of the ground. There's still some snow banks around, things like that. So rural transportation, there's limited public transit in rural areas. There are fewer schedules. In many cases, if there is a bus that goes by, it might go by twice a day, go by perhaps twice in the morning and twice in the afternoon. Uber and things like that, you can't even find in many of these areas, Lyft, etc. There's Medicaid transportation providers, and they're either not reliable or unavailable in many rural areas. Let's remember that there's limited broadband and cell service. I have 1 to 0 bars on my phone a lot of the time when I'm out in various areas. Last mile connectivity is the real big factor for older adults. Even if there is a bus going by on the nearest paved road, if you're a mile or 2 miles up a road, perhaps like this one in the picture, how are you going to get down to that? So it's not available. And I should note that it's not limited to older adults. There are many migrant and immigrant workforce members without a vehicle. The same thing applies to people like that. And let's not forget that there's the physical challenge. There's mountainous regions, dirt roads, mud, ice, snow, those kinds of things. Those aren't the kinds of factors that affect urban and suburban areas very much compared to rural. Next slide. And unfortunately, technology, self-driving cars, etc., are not always the answer. This incident happened again in my state of Vermont. A driver was following his GPS and plunged into Lake Champlain. I will tell you that we have what are called Class 4 roads in Vermont and in New England and other areas that are nothing more than a snowmobile trail in the winter. They are often impassably muddy in the summer. Your GPS will take you blindly into those roads. So self-driving cars, beware. I think that's unlikely to be something that's going to be viable in the near future, if ever. We have a mountain pass, a road that goes over what's called Smuggler's Notch. Route 108 goes from Stowe over to the other side of the mountain. It's very twisty. It's got one area at the top that has some very large boulders. It goes down to one lane. There's a sign that shows up on the interstate that says there's a $2,400 fine for taking a tractor trailer into there. And the sign that says, do not believe your GPS. Every year, 2 or 3 trucks go to every 2 or 3 times a year, trucks try to go over there in spite of the sign, and they get stuck, literally stuck, and have to be towed out. So it's just not always going to be the answer. Next slide, please. So why volunteer solutions as opposed to some of these other things? Well, and this is the same things we've heard. Volunteer is right-sized. It's appropriate for small, very small communities or larger geographic communities. It's local. Rather than top-down solutions from the state or federal government. It's great that they're working on it, but they seldom are terribly effective when you get down to the micro level. They're community-based. What makes more sense, and Nancy referred to this as well. Volunteer driver solutions are, they're right in the heart of the community. They're people who know each other, who know what it's like getting around. Flexibility is really key. Scalable, that's one of the real beauties is it can be, we can scale those things up as the need increases, and we know that the need is going to increase. And finally, that's what's traditional about rural. It's neighbors that are helping neighbors. That's the way we've done things forever. Next slide, please. So I said the last thing I want to leave you with is that transportation is medicine. And volunteer drivers are as much a part of the care team as doctors, nurses, medical assistants, and everyone else on that care team. Transportation saves lives, it improves the quality of lives. It's as good as medicine. So just keep that in mind, that health, rural health is so dependent on this. And then just one last slide really quickly about us. We are the New England Rural Health Association. We have a mailing list of over 6,000 people that we reach, rural health professionals and so on. We'll be celebrating our 30th year of service next year. We do a lot of advocacy, things of that sort, and support rural health workforce and so on throughout New England. So thank you for that. And it was a real pleasure getting in front of you today. Thanks.
Thank you, Andy. Got it right this time. All right, my colleague, Nick Candela, is now going to address some audience questions. Nick?
Yeah, thank you, Marcia. Okay, the first question is for Nancy. Nancy, from a national perspective, what's the biggest misconception about transportation and older adults that needs to change for real progress to happen?
I think the biggest challenge is that people don't tend to think about the transportation challenges of older adults, to be honest. And I think much of our policy is focused on different sectors. You know, what do we need to do on highways? What do we need to do in mass transit, et cetera? And don't focus specifically on the individual. I think that's incumbent on all of us in the advocacy space during the next big transportation debate to make that point.
Great, thank you. Next one is for Andy. Andy, in this environment, a lot of programs are being asked to do more with less. Where are you seeing models or approaches that are actually holding up, and what makes them work?
I think this is one great example is volunteer fed programs are really going to be critical. A lot of organizations are finding that they actually can do a lot more than they thought they could. We've had some funding that's been an investment that's been very generous for a number of years, and a lot of that has dried up recently. It'll come back. We do have things like the Rural Health Transformation Program that promise to inject some funding, but ultimately, what's happening, and this is one of the things I see in our rural health centers and critical access hospitals, is that they have a history of being innovative. They have a history, they've always been either side of break even, basically. So this is nothing new for them. They are finding ways to work together. They're doing things like group solutions of shared services. They're using solutions like telehealth and so on. But basically what they're doing, I think a lot of people they're learning how to partner with each other within their communities. And to partner, one of the things I think is critical is to understand that these are economic development issues, and to make sure that they bring the business community into the discussion too.
Great, thank you. Okay, next one for Nancy. Nancy, if you could move one policy or priority forward right now that would meaningfully improve mobility for older adults, what would it be and why?
I think as we look to the next big transportation bill, we'd want to see if we can get some dedicated funding, particularly for underserved areas, rural, other underserved areas, because that, I think, is the most effective way to target some of the issues, particularly for older Americans. I don't know exactly how we do it. Typically, we do it by giving money to local, state or local transportation authorities. But I think providing some kind of targeted funding for transportation systems outside the metropolitan areas is probably the area I would put the most focused at this stage.
Thank you. Andy, What is the single biggest barrier you see holding communities back from expanding transportation for older adults? And what would actually unlock progress?
I think there are years of underinvestment. Again, the lack of perception of the barriers faced in those communities. And again, it's important for everyone to realize that rurality is, it doesn't mean you're in the middle of Idaho or Alaska or somewhere like that. If you're, as I said, 15 miles away from the nearest hospital, if you don't have access to private transportation and you're in a rural area, you're suffering from disparities, from health and other disparities. So there are some policy issues that really need to be worked out at the federal level and the state level, and they're around parity for rural areas, particularly. The solutions, and as Nancy's talking about advocacy for transportation bills and so on, it's important to realize that the same solution does not fit all areas. So there needs to be targeted investment and policies that realize that acknowledge the realities of the disparities faced in rural communities.
Thank you. Great answers. All right, I'm now going to pass the microphone over to Katherine Freund. Thank you.
Thanks. I just see one question in the chat that comes up often, so I just want to respond to that. And it's volunteer driving recruiting has obstacles such as background checks, vehicle safety, insurance liability. How are these being addressed? There are actually 3 different issues. For America's Volunteer Driver Center, we do ask people who want to volunteer if they would agree to a criminal history check and a moving violation check. And we see that as just the most basic safety issue. And if people really don't want to do that, they don't have to, but there needs to be another way for them to volunteer, because the safety of the people who are being driven it's paramount. We can't ignore it. As far as insurance is concerned, Nancy touched on that briefly with Connecticut. Part of what we're doing with America's Volunteer Driver Center is a review of volunteer policies across the country. And when that's complete, we're going to put it in a searchable database on the website. And we are planning to use artificial intelligence to keep it updated. Wish us luck, but we use artificial intelligence to keep Rides Inside, our national database of transportation providers, updated, and that's working very well. So I think that's a good use for artificial intelligence. Okay, I just want to remind Joe to please put in the chat a link to AVDC, America's Volunteer Driver Center. So if anybody wants to participate in any way, they can sign on. And also, if anybody wants, for the price of a cup of coffee, to get a package of grass seeds and be part of the grassroots movement, there's another link for that. Okay. And so now we're gonna, I think, go to our transit frontier. We always do a quick evaluation at the end of this collaborative and ask people, how to score things. And always the transit frontier gets the highest marks because everybody loves to hear from the field. And I love the term, the transit frontier. So let's begin by introducing Erica. Erin, I got that wrong. Sorry, Erin. She is the CEO for Neighbor to Neighbor, which is a volunteer transportation program in Myrtle Beach, South Carolina.
Hello, everybody. Thank you, Katherine. This is so awesome. Such great folks. Yes, I'm Erin Walters, Neighbor to Neighbor. We're coordinating over 200 volunteers, actually over 4,000 square miles. We have lots of, as referenced, oh gosh, I wrote a note too, the urban, very low walkability around, even in our urban areas. So 165,000 older adults over 55 in one county alone, and achieving over 8,000 rides with no vehicles. We're excited to be here. Thank you.
Do you want to say anything else about your service or what you're doing?
Sure, I wasn't sure if there's other conversation. I mean, we are touched on everything you all said. We're so excited about the workforce in the rural area. So we've gotten more and more of these early retirees moving to the area that have said we've saved their lives. You know, they didn't know how much they needed to be doing this. Everybody's on a fixed retirement, as I say. And so we do provide some mileage reimbursement, and it's helped them be able to do more in the community. So that's been successful. And we're working with the hospitals with the RHTP program, Andy. So I'm glad you brought that up. And fortunate or unfortunate, you know, transportation does not necessarily equal the infrastructure. A lot of times we're talking about infrastructure, you know, around our highway and transportation legislation, like Nancy was talking about, and it doesn't always translate directly to the transportation needs. So I just want to highlight that. And then same thing with the HTP program. There's no transportation per se in there. It's access to healthcare. And so transportation folks on the call, put yourself out there, send them a letter that you know in the hospital of what you can do to help them, and they might be able to get it involved in this program. Be good stuff.
Let me ask you a quick two-part question. First, for those people who volunteer to drive for Neighbor to Neighbor, what do you think motivates them to do that? There's a lot of ways to volunteer. You could help in a soup kitchen, you could help break trails in the parks, you could be part of Big Brothers, Big Sisters, but these folks are volunteering to drive. Why do you think they're doing that? Number one. And number two, what is the biggest concern that you feel that the volunteer drivers have about what they're doing? Why would they be worried about volunteering? Why would they not volunteer? And any of those questions.
Sure. So a lot of the folks are, especially in our area, transplants from somewhere else where mass transit exists, like myself. And family has always used the train and the buses to get around a lot longer than we can. There's none here, so very little. So that's been a big motivator. They already see the need in our area, and the connection to helping people age with dignity longer independently is huge. There's conversation happening thanks to AARP and the rural health around how to age independently. But again, said having the conversation, coming up with the solution hasn't really been part of the conversation. And so we're trying to increase that. And these folks are retiring, they're having their little vacation, and they're getting bored. We're in a little city. We have urban and rural sprawl through here, and they want to make the connection. And it's been great. We share stories. We have a huge volunteer appreciation week happening right now. And so many people are connecting with friends and family that they didn't, extended friends and family that they didn't even know about, because we're such a melting pot in our area. It's helped everybody age well. A lot of the volunteers are always saying, I didn't know this would help me so much. So the concerns, a lot of people are concerned about insurance. It's always the first conversation. Let me tell you, knock on wood hard, over 20 years. Knock on wood, the little bit of fender benders we've had have never had a client in them. And I think we've said folks that register to drive are good drivers, and they're a fit for the program. And we're driving at smart times. Typically, even with the rural rides, it's a shorter distance than, or more prepared distance. They know the area. It's in their common area too, to know where they're going. So that might be the first concern, but it never happens. The real concern afterwards is, I want to do more for them. We're always talking about boundaries. A lot of folks see the need and see the further need. And we unfortunately do still have to restrict folks to 2 rides a week. We'd love to open that up based on availability. And so they love to give more when available.
Hey, thank you. You said a lot of things that really resonated with me. One of them was that you think that the people who volunteer to drive are really safe drivers, and we think so too. And we're trying to get a research project funded to prove that they actually are safer than the average driver. So thank you so much for joining us today, Erin.
Thank you for having us. Thank you for this great opportunity.
So from the Transit Frontier, I'd like to introduce Joe Mitchell, who is a volunteer driver in what he calls the thumb of Wisconsin. So Joe, we'd love to hear from you.
Well, thank you for this opportunity to listen in and to share with you that a bit about the context where I volunteer to drive. The Door Peninsula, if you're not familiar, go up the west shore of Lake Michigan a couple hundred miles. There's a peninsula nearly 100 miles long north to south that sticks out into Lake Michigan. It's a largely rural area that there are 30,000 people in the entire county, and there's one hospital, a critical care hospital in the middle of the county. But for specialty care, we travel down to Green Bay. For some, that can be a 2-hour drive if they have a car and the roads are good. That I personally find it is very enjoyable and meaningful for me to drive, partly because I enjoy people. I'm a retired pastor, but also because as a retired pastor, I appreciate working and volunteering with an organization that understands how to manage and motivate volunteers. The organization here locally is Doortran. They started, the county recognized, because we're, as you've mentioned, getting older in our rural area, and because medical care is a transportation issue, as well as other needs for transportation are critical and difficult in this county, that people in the community started talking together, 10, 15 years ago. And Doortran houses a number of different issues that have arisen, and I would highlight that as a key point to recognize it isn't just volunteer drivers, it's a number of different things. And having an organization like Doortran that knows how to work with volunteers and with riders, people in the community, is really key to having a good functional system that is very community-based. And I highlight that this, for us here, in my mind at least, is not just about transportation. It is about the quality of community that we want to have, that I want to have as I grow older in retirement here. That I understand that Doortran not only listens to riders when they're calling in for a ride to understand their circumstances and what their limitations, what their needs are, but also follows up with them. I personally know that one of the riders that I took home who was struggling was not poor, he was quite well-to-do, but was trying to stay in his home on the lakeshore probably a little longer than he was really capable safely. I let them know, and some of the staff at Doortran followed up just to make sure he was safe. And I highlight that as that this is not just a problem, it is an opportunity to build the kind of community that we want. Now, I've understood after 40 years of pastoring, the parishioners taught me over the years that it isn't just a matter of caring for people, it's a matter of listening, and listening deeply, listening not to respond to them, not to fix them, but to understand them more clearly. So I use the opportunity of driving. Usually it's about an hour's drive down to Green Bay to take them to specialty care down there or shopping down there. And I will listen to them, not just for what they say, but for the values, the fears, the history. And for a lot of these folks that are socially isolated, they're very ready to share what's going on in their life. They want the social interaction. I find that very rewarding, just to hear their story, to reflect it back to them. And even if I understand and recognize that this is a person that I probably don't agree with in a lot of ways, we can find some common values. and common feelings and circumstances in our lives that when I reflect that back, we understand each other. We overcome barriers and we form community that before the ride, they may have felt socially isolated, but now they know that there's a neighbor who knows their name, knows where they live, and is ready to help them if they need something special. And so it has been very meaningful for me. And it has also been a great joy because I take each ride as an opportunity to discover not just a person in need, but a person with gifts and abilities with an interesting history. Last summer, I had the chance, was given the opportunity to give rides to a man a little older than I who'd had some very significant surgery. He'd given me permission to share some of his story, that he was needing rehab basically 5 days a week here in Sturgeon Bay. It was only a 10, 15-minute ride, and there were other means locally that he could have gotten the transportation. But it was a real problem getting it scheduled and on time to get to rehab his appointments and get home again. And the family wasn't able to do this that often. What he discovered is his background initially as a concert pianist who had gone to prestigious schools, very interesting fellow. Well, arthritis shortened his performance career, so he taught in universities. From there, the arthritis limited him further, and he made a transition into law, interestingly enough, and later was elected a circuit court judge here in Wisconsin, down in the Madison area. What we very quickly discovered, much to both of our surprise, was that we really enjoyed understanding and hearing the unique perspective each of us brought to conversation about topics of mutual interest. We quickly became good friends. I even looked forward to, I set time apart because I wanted to give Gary a ride every day. It was only a short ride. And now he and his wife, who is a professional harp player, they go to Florida for the winter, and we have stayed in touch even while he's down there. Every couple of weeks, we call and talk for about an hour or so, catch up on how each other's doing. We know each other's kids. We talk about issues. We talk about Door County. And it's a real surprise and joy just to be able to do that. So that
Joe, I think, excuse me, I think what the story you have told really echoes the kind of relationship that so many volunteers develop with the people that they transport on a regular basis, and underlines the comment I have heard so much that people get more out of volunteering than they give. So thank you very, very
You're
much
very
for
welcome.
sharing that story with
Thank you for
us.
this opportunity.
Yeah, absolutely. Thank you. Okay, so now I want to introduce Bill Goodman, who is a rider. So we've heard from a provider, we've heard from a volunteer, and Bill Goodman is in Lexington, Kentucky, and he is a rider. So thank you so much for joining us today, Bill.
Well, thank you, Katherine, and hello from Kentucky to all of the participants on the call today and participating from all across America. I want to tell you a little bit about my experience as a writer for ITN Bluegrass, which has become a valuable resource for me and for many, many others in the Fayette County, Lexington, Kentucky surrounding area. I began to lose my vision to glaucoma about 4 years ago, and immediately soon after had to give up my ability to drive anywhere, especially to and from my office. I am still working at the time, and found that it was going to be difficult getting from my home to my office or to appointments. My wife was also working, and although she's a a valuable asset to me in my career. She was not always available. Public transportation in Lexington is excellent, but again, it was not always that convenient. From the Lexington Senior Center, I discovered ITN Bluegrass and began to find out a little bit more about them and trying out the service that they provided. And quite honestly, it has become a lifeline for me. It's enabled me to continue to work and do my work here at Kentucky Humanities, a nonprofit affiliate of the National Endowment for the Humanities. We do work statewide, and there are many opportunities for me to take advantage of ITN Bluegrass to get me from appointments that I need to attend. Also, visits to my ophthalmologist, to my primary doctor. But I want to tell you also that it's not only for low vision and blind, it's for, as we've discussed today, for older citizens in this area. ITN Bluegrass has adopted a slogan, whether it's the national ITNAmerica slogan or not, but that's arm to arm, door to door. The service that ITN Bluegrass provides for its constituents is to be sure that, for example, when they come into my office, they not only park in the lot and wait for me to exit to get into the car, they come into the office to be sure that I'm ready to go. At times when I'm not familiar with a particular building or steps, they provide assistance to me getting into the office by using that door-to-door, arm-to-arm. Sometimes if it's going to be a longer visit, they will either wait, or then somebody else comes and picks me up and takes me back to my office. Once again, it's become a valuable assistance to me as I go on this low vision journey. I'm highly recommending it to as many people as I possibly can. We, as you are underway with your volunteer effort, we are also looking for volunteer drivers here in the Bluegrass and want everyone that has a little time on their hands. Katherine, as we have discussed, sometimes it's only a couple of hours on a day of the week that someone can give up their time, or an afternoon that they are available during the week. Once again, I'm certainly an advocate for ITNAmerica and ITN Bluegrass, and hope that more people will take advantage of not only the service that's provided, but also the volunteerism that is much needed across Kentucky and across America.
Thank you, Bill, very, very much. Okay, well, I think we're down to the last few minutes here. I want to say that I just feel so lucky that we've had so many wonderful speakers speaking from their hearts and speaking from their own experience today. So thank you very, very much. There are many questions in the chat that we cannot get to today, but I promise everyone who submitted a question that we will respond to you and get back to you. There was one question, I see somebody's put something in the chat. There was a question about, did either ITN or AARP have a list of all the volunteer programs in the United States? And the answer is yes, absolutely, we do. There are more than 1,000 volunteer programs coast to coast in the United States. And there's something in the chat, www.ridesinsight.org, that you should all know about that link, because you can find any transportation in the United States for older adults or people with mobility challenges right there, and all of the special needs that they serve. You can find out about it, whether it's someone who needs a wheelchair accessible vehicle, someone who is visually impaired and needs the arm-through-arm, door-through-door service that Bill Goodman recommended, or someone who needs a ride that is free, or someone who is a veteran. All of that information is available on the Rides Insight website, and there is also a toll-free hotline that people can call if they are not used to using a computer and don't know how to search. So Joe, if you'd put the phone number there in the chat also for people so that they can share it with others who may need it. So I think we're kind of coming down to the end here today. I want to invite everyone again to be a part of what we are doing. I believe we have the answer in our own hands, and that we can help each other. We think of community as local. We think of it as our neighbors. We call it neighbor to neighbor, and it is. But as someone who's been talking to good people in every state in the country, I think we can look at the United States as a community as well. I really believe that, and that we're all part of the same country. We're all aging. If we're lucky, we're aging. And I think this need comes to us all, that while we can still drive, if we can still drive, there's lots of empty seats in our cars, and we can share those with others. Also, if you want to be part of the campaign, and do you have a slide for us, Joe? If you want to be part of the campaign and you don't have the time to volunteer, which we understand, people raising families, people with children, people who are doing caregiving, people who are working 1 or 2 jobs may not have the time to volunteer, but you can be a part of this campaign by going to the ITNAmerica website, and for the price of a cup of coffee, you can be part of the national campaign. Doesn't look like the link is in there, but Joe will put it in the chat. You can be part of it. And I think I have your grass seeds right here, everybody. We will send them to you with a letter of thanks. And if you plant them, we're going to ask you to take a picture of your grass and your grass roots, and we're going to put it up on YouTube. So you don't have to dump a bucket of ice water over your head. You just have to plant your grass seeds and share the idea with a friend, and we'll put you up on YouTube, and you can be an example for everybody else. So thanks, everybody. Thank you very much for joining us today. I want to thank you all from my heart, from my head, for being with us here today. I think this is the start of something very, very beautiful for families, for communities, and for older adults across the country. So bye from ITNAmerica. Thanks again.
Thank you.